Depressed fractures and epiphyseal plate fractures. What is a depressed fracture in science? A depressed fracture is where bones are displaced inward in the cranial bone. It creates a depression of the bone in towards the brain. Signs of a depressed fracture include clear fluid running from the ears or nose, black eye with no damage around the eyes, visible trauma to the skull or scalp, bleeding and bruising from one or both of the ears. Where does a depressed fracture occur? Most commonly, a depressed fracture occurs in your brain, usually resulting from blunt force trauma or getting hit in the head hard. It's a break in the cranial bone with depression of the done in toward the brain, of the bone, excuse me. Who is susceptible to a depressed fracture? Males are most likely to get a depressed fracture than females, but children are more susceptible to head trauma than adults because a child's head is approximately 18% of the total body surface. Treatment and repair. Patients with open cranial fractures depressed greater than the thickness of the cranium should undergo operative intervention to prevent infection. Patients with open depressed cranial fractures may be treated non-operatively if there is no clinical or radiographic evidence of dural penetration, significant intracranial hematoma, depression greater than 1 centimeter, or frontal sinus involvement. Elevation and debridement is recommended as a surgical method of choice. Primary bone fragment replacement is a surgical option in the absence of a wound infection at the time of surgery. All management strategies for open depressed fractures should include antibiotics. Athlete story. Blake, Blake, Blake Jeffrey plays hockey for the Montreal Canadiens and suffered a depressed skull fracture. This injury occurred when the Canadiens were playing the Syracuse Crunch, and Jeffrey was skating down the ice when he took a hit from Syracuse defenseman Cody and flew into the boards. When Jeffrey crashed onto the ice and and the left side of his head landed on Coates' skate, fracturing his skull. Jeffrey was having seizures and was rushed to the emergency surgery to put a metal plate in his fractured skull. Jeffrey will be able to recover well from his injury because of how quickly he was rushed into surgery, and he will take antibiotics and anticonvulsant medication to make sure he stays healthy. How would an athletic trainer treat this type of injury? If an athletic trainer is treating an athlete with a depressed fracture, they should immediately call 911 for an ambulance since most of these injuries are cranial and are very dangerous. Make sure the athlete is breathing okay and has a pulse, and make sure their head and head are stable. If the athlete has a wound of cut on the head, use sterilized gauze to gently cover the wound. Pull out the athlete's emergency medical forms and contact their parents if they are not there. Epiphyseal fracture. What is it and what are the signs? An epiphyseal fracture is when the growth plate at the end of a long bone is broken, fracture. The metaphysis is the widened part of the long bone, with the epiphyseal being the end of the bone. So the growth plate is in between these two. Signs and symptoms. Visible deformity, crookedness of limb, inability to move or put pressure on limb, swelling or tenderness in the area around the end of the bone. Where does an epiphyseal plate fracture occur? Most growth plate fractures occur in the long bones of the fingers. They are also common in the outer bone of the forearm and the lower bones of the leg. Who is susceptible to an epiphyseal plate fracture? Growth plate is the last area of a bone to harden during growth. Children and teens are vulnerable to growth plate fractures or injuries. Similar injury in an adult can cause a sprain. Treatment for an epiphyseal plate fracture. Operative treatment is required when slight residual displacement can result in formation of a bone bar that causes limb length discrepancy and angular deformity. The fracture is commonly treated with transverse lag screws across the epiphysis. In some cases, many growth plate fractures can heal successfully, not non-surgical, if treated with immobilization. Athlete story. There are not any stories of an athlete that have had epiphyseal fractures that I could find, but this injury is the most common in children and teens. Children and teens' bones are still growing, and these growth plates are so vulnerable to fracture because they are the last part of the bone to harden. What would an athletic trainer do? If an athletic trainer is treating an athlete with an epiphyseal plate fracture, they should take the athlete off the field of play and keep the break immobile through a temporary cast. When they go to the hospital, a doctor will put on a hardening cast and make sure he does not move for a long period of time. If the break is very bad, call 911, but most of the time it is just necessary for the athlete's parents to take them to the hospital or emergency room. That's it.